Hey guys, my name is Landon Reinhardt. First name is Niles Reinhardt, and I am here to present a very relevant issue in modern society, and also something that's become quite prevalent in the field of nursing, and that is substance abuse. Now, substance abuse is a major issue in modern society. I will be specifically tackling use among nurses. Now, for starters, many careers are affected by the use of substances. Substance abuse is a vicious cycle of addiction that it is usually a disease that people are born with, such as alcoholism or addiction. These are diseases. These are not usually things that are picked up and acquired, although they can be. Usually, the tendency to abuse substances is a genetic predisposition that someone can't help, but it's usually triggered by something like stress at work or any type of external stimuli that makes the nurse, in this case, unstable. And in all professions, this is an issue. It's not just in nursing. We hear many substance abuse stories, even among law enforcement officials. Like I've heard of judges and prosecuting attorneys and cops all abusing substances. It's very, very prevalent in modern society. It doesn't matter if you're blue or white collar. It happens in all jobs. As you can see here, there's a teenager abusing marijuana, which is very common. It was very common at my high school too, and that's why I put this picture up. And that brings up my next question: why do people use? Well, I just mentioned that it's usually a genetic predisposition, but people use usually because of two main reasons. And these two reasons: one, the person likes the substance and its effects. For example, this guy on the slide, he likes to smoke weed. He likes to feel high and play video games. And, he just doesn't think anything's wrong with that. And, although weed has a lot of negative side effects, it is legal in some states for recreational use. And I will mention that in a later slide. So, two, the person is trying to mask a character defect or the past. We see this a lot more common in alcoholics and addicts. Number one tends to be linked to people that just enjoy a substance and have a problem getting off of it. And number two is, you're really trying to mask your past or a character defect. I've even seen this in some of my friends that have OCD, post-traumatic stress disorder from serving in our military, etc. So this brings me to my next slide. Pills, pills, pills. Pills are everywhere. Literally. Keep in mind that literally half of the country is prescribed some sort of pill, whether that be a beta blocker, a benzodiazepine, or an opiate for pain. Some sort of pill is prescribed to 1 out of every 2 people. And this is a fact from, as you can see on the slide, the Center of Disease Control and Prevention. And I have written my own research on pill prevalence. I actually did my junior thesis at UNCA, entitled it An Overprescribed Country, because our country is simply overprescribed. The pharmaceutical industry is so money hungry that they're dishing out any type of medication they can to people, and it is honestly sickening, but nothing can really be done about it at this point. So, substance use. The main thing we're talking about. Like I said, it's very prevalent in modern day America. And alcoholism, like I touched on earlier, is a genetically predisposition in your genomes. And it also involves drug addiction. They tie in with each other. They're a very similar character defect that you're born with, and they usually go hand in hand. Usually people who are alcoholics are addicts too. And a drug addict and alcoholic can't help the disorder they have. And it is unfair that a negative stigma has been attached to these groups or these individuals, because many of them do turn out to be great and to have good jobs and to be very successful. I know an alcoholic personally. He's one of my mom's friends. He drives a Lotus and a Porsche. He's a very successful businessman here in Asheville, and he's an alcoholic and an addict. And he was telling me that if you're an alcoholic, you're usually an addict too. He's like, you like to do everything to escape your head. Once you take that first drink or that first hit of weed, you don't stop until you pass out. Those were his exact words to me. And I just can't grasp that, but I wish I could. I wish I could understand it from a first person point of view. But anyways, bottom line, very prevalent in modern day America, and alcoholism is genetically acquired. So usually with alcoholics and drug addicts, we have these 12-step programs, and they're very successful. AA is one of them. I'm sure you've all heard of AA. And NA is another one that deals with specifically narcotics and drug addiction. AA is mainly geared towards just alcohol. So these programs are great, and they're very effective. And not only do they help people recover from alcoholism and drug addiction, but they also help people lead a better life. These 12 steps, involve things like making amends to people that you've hurt, and um, you know, making a personal inventory of your character defects. Most people don't do these things, but we all have character defects, and we could all learn something from AA or NA, regardless if we're an addict or an alcoholic or not. So my next question to you guys is, can substance abuse affect everyone? And yes, it can. No one is just immune to developing substance abuse problems, whether you're born with alcoholism, that disease or not. Substance abuse affects people of all ages. As you saw the high school kid smoking a joint on 3 slides back, or an elderly person abusing their opioid prescription for pain. It affects people of all races, white, black, Asian, doesn't matter actually, but Asians are the lowest to abuse drugs. They have the lowest abuse rate out of all races, which I found interesting, and it's probably due to their strict culture that they live in. And also, occupation doesn't matter. Like I said, white collar, blue collar, whatever collar, gray collar, you can abuse substances. It really doesn't matter like what you do. This phenomenon of abusing substances and going to work high is not past anyone, and it's something that everyone needs to be aware of. So yeah, like I said, it doesn't matter if you live in Section 8 housing or if you live in the biggest manor, up on the mountain. Substance abuse can affect you. And now let's talk about it in nursing. So substance abuse in nursing, it's really specific. If an alcoholic is actively using while on the job, then they are only, putting themselves at risk usually. Like say, you're an electrician and you're in a house by yourself and you're drunk hooking up wires. The only person you're really putting at risk is yourself. But although you might mess up someone's home, you're probably not going to mess up their life. Now the problem with nurses abusing substances, and doctors too, surgeons, all these professions in the medical field, is that your patient is your primary care, and you are putting your patient's life at risk too, and it's a much higher risk than doing other jobs. Now if the nurse is using, they are not caring for themselves. How could they possibly care for a patient? That is a point that's brought up by an agency that I will discuss in a further slide. And nurses, like I said, under influence are a very distinct challenge, and to the medical profession as a whole, it's just something that's hard to tackle because it's something that can't go on in our field. So let's talk about the ANA. The ANA, as most of us know, is the American Nursing Association. And the American Nursing Association, they acknowledge that this is a problem. Substance abuse is a huge problem in the nursing field, and using illicit substances on the job. Now, the ANA states that these nurses cannot possibly care for a patient if they can't care for themselves, like I mentioned on the previous slide. how can you care for a patient when you can't even care for yourself? The SUD stands for substance use and dependence. And substance abuse and dependence was termed by the ANA, and this refers to the disorder of using substances while on the job. It was also termed by the HHS, the Health and Human Services, and I think that's where the ANA got it from. And the SUD covers a wide variety of substances, whether that be opioids, marijuana, alcohol, anything. But we see a higher prevalence with opioids than any other drug, and I'll discuss why in a second. So there's a huge problem in nursing, and that's that pills are all over the place. You know, you're giving your patient pills. You're dealing with pills 24/7, scanning pills with your barcode scanner, bringing them to patients' rooms if you work inpatient. And you have such access to these pills that it's, hard for some nurses to avoid them. And, maybe a nurse one day thinks, oh, I'll take an opioid, I'm in pain. And the next thing you know, they're addicted, whether they have addiction in their genetic predisposition or not. Like I said, they're so readily available in nursing professional setting. That's why this is such issue. So what substances are they abusing? Like I said, they're abusing everything from alcohol to prescription painkillers. But prescription painkillers are the #1 dilemma right now. President Trump actually declared a state of emergency on the opioid epidemic because people are not only abusing real opioids, they're making synthetic opioids and also dishing out fentanyl on the streets, and it's killing many kids younger than myself. So this is just a huge issue that needs to be addressed, but it's almost like the cocaine epidemic and the Pablo Escobar in the late 80s, 90s. It's something that's coming into the country so fast. How do you get rid of it? And nurses are even abusing pot. I mean, how can you smoke pot and go care for a patient? I mean, it's a drug that makes you so paranoid and so, out of it. I knew some people in school that smoked pot and they just never really did anything. And, I don't see how you could take care of a patient if you were under the influence of marijuana. So what's to be done about this? Well, luckily, there is a solution to this problem, and there's many substance abuse treatments out there and outpatient rehabs that someone can go to. But luckily for our field in nursing, there are specific organizations dedicated to tackling substance abuse in nursing specifically. And these aren't 12-step programs like AA and NA. These are very, very specific. So how can a nurse return? This comprehensive monitoring system tries to ensure a safe return from for the nurse to the workplace. And here are some organizations that are dedicated to addiction. There's the AANA, the NIT-NSA, which is the main one focused on addiction, and the ENA, the Emergency Nurses Association. And the ANA basically overlooks everything going on in the nurses' anesthetics, including overlooking advanced practice procedures like open heart surgery. And the ENA, on the other hand, works to promote safe practice and safe care. Now, the INT-NSA, the main one, is a professional specialty organization founded in 1975. And this is for nurses committed to the prevention of substance abuse among nurses. This is the most specific, the INT-NSA, and that deals with it, nurses and addiction. So there's a brick wall at the end of this. I wish I could tell you that there was just this, obvious solution to the problem of addiction, but addiction is a lifelong struggle, and people in 12-step programs will tell you that. So addiction in nursing is a very tricky objective to tackle, and the reason why is because it's very specific and goal-oriented. Nursing is, and your primary care, like we've discussed, is the patient. And like I said earlier, if you can't care for yourself, how are you going to care for a patient? And little research has gone into potentially illegal drugs. Medical marijuana, for example, is legal in many states. So this poses a question, like, can I smoke weed and go to work? It's legal. Also, if someone is prescribed a medication like benzodiazepines for their anxiety, how can somebody tell them that they can't work their nursing job because they have a high level of anxiety, even though they are taking quote-unquote illicit substance? So opiates are also prescribed for pain, the main problem, and some people have chronic pain and have to take opiates. Who are we to tell these nurses that they can't take their prescription opioids? So these are all areas of gray that bring up, really complex thought to me and to others, I'm sure. And people love their equality here in the United States, and when they feel like their equality is being taken away, we have massive upheaval, we have massive riots, we see it all the time. And ripping a nurse off their medications and saying you can't take this because you're a nurse, I don't think that's the solution. I think that we need to come up with a list of medications that's appropriate for nursing and a list of medications that a nurse should only take at home because they're too impairing to take on the job. After all, like I said earlier, over half the country takes some sort of pill. So there has to be something done about what kind of pills a nurse can take and what kind of pills a nurse can't take. So, and here are my references, and thank you very much for watching.